Did you know that our bodies produce up to 4 pints of saliva a day? According to the American Dental Association, chronic dry mouth decreases the quality of life for up to 20 to 30% of the people in the United States, and if left untreated, can cause serious dental and health problems. So what causes this condition? Who does it affect? And what can we do about it? Well, joining us today is Dr. Susan Cutler, Head of Medical Affairs at Aura Pharma. Welcome, Dr. Cutler.
Thank you so much for having me.
You know, often on this show, we talk about how the mouth is really a window to our general health. So can you tell us what exactly is dry mouth and what causes it?
Dry mouth, also known as xerostomia, is not a disease, but it's a condition. It can be a symptom of an underlying disease, such as diabetes, something called Sjogrens syndrome, which is an autoimmune disease that attacks the salivary glands, or it can be a result of over 500 medications, such as antihypertensive medications, anticholinergics, which are often used to treat Parkinson's, antihistamines, antidepressants, and not just patients with xerostomia, but patients undergoing cancer therapy and radiation therapy often have a dry mouth condition called oromucositis, which can be very uncomfortable and can actually affect 97 to 100% of the patients undergoing these treatments. Together, the patients with xerostomia and oromucositis need to let their doctors know that they are suffering from these conditions.
What are the symptoms? What do people complain about?
Well, they often complain of difficulty swallowing, difficulty eating, chewing, speaking. Some patients have extreme amounts of discomfort. They have bad breath. Other symptoms involve difficulty wearing dentures just because of the lack of saliva. Saliva is critically important. In fact, it's considered one of the most important biologic factors. It also helps to kill bacteria in the mouth. Saliva coats the gum tissue to lubricate, to allow the patients to swallow more easily. Patients who don't have saliva really have trouble functioning. In fact, they tend to drink a lot of water during the day because their mouth is so dry, which, for example, can make them get up in the middle of the night just to go to the bathroom. So it really does affect everyday life.
Well, what are the consequences of not having saliva?
If you look at what makes up saliva, it's calcium, phosphate, bicarbonate, sodium. Very simple ingredients, but calcium and phosphate are actually what teeth are made of. What we find is in patients that have dry mouth, they tend to have more decay. They have a lot of cavities.
Is that the acid that's getting to their teeth?
It's not just from the acid, but also the calcium and phosphate help to remineralize the teeth. And because patients aren't having debris and plaque washed away from their teeth, they have plaque accumulation, and that can often lead to halitosis or bad breath. In addition to that, patients find that they can be more prone to yeast infections in the mouth. So there are numerous sequelae that we see from having dry mouth.
Is there a solution when you have dry mouth?
Absolutely. There are many treatment options that are out there. The first thing, of course, is to make a diagnosis. We need to make sure that there's no underlying condition, systemic disease, causing the dry mouth.
Okay.
And if it's from a medication, I'm in no way suggesting that patients stop their medication. They should consult with their physician, find out possibly if there's another treatment option. But if not, there are remedies that can help patients. In addition to that, once we figure out why the patient has a dry mouth, there are many options for treatment. Some of the options involve prescription drugs. Sometimes it just may be an over-the-counter type of rinse. But let me tell you a little bit about NeutraSal. So NeutraSal supersaturated calcium phosphate rinse is a medical device that treats the symptoms and mimics saliva. It's not an anti-cavity rinse, but because it has calcium and phosphate, it does help to remineralize teeth. It also replaces the normal, what we call ionic balance, or the normal balance in the mouth. NeutraSal does not cure dry mouth. It doesn't prevent dry mouth, but it does mitigate the symptoms and provides relief. What these types of rinses do is it helps to bring the pH up or reduce the acidity in the mouth.
Okay, so again, you're not stimulating more saliva, you're mimicking it. Can you show me how that works exactly?
Absolutely. NeutraSal comes in these very easy to use packets, and what we do is dissolve the NeutraSal in 30 mLs or 1 ounce of water, any type of water.
And it's important to use just the right amount of water,
yes,
right?
Absolutely. We need to use the right amount of water and stir it until it's clear or nearly clear. And what's important is that the patient rinses with this within 15 seconds. And the way that it's used.
And why 15 seconds?
Well, it's super saturated, which means that the solution is packed with calcium and phosphate ions. And by mixing at the time of use, you're getting the maximum amount of calcium phosphate without it evaporating. And the way that the patient uses this is they rinse with half of the solution within 15 seconds, and they rinse for 1 minute and then spit out. And then they rinse the other half of the solution and spit out. And the only thing the patient has to do is not eat or drink for 15 minutes.
I've seen the pre-mixed dry mouth solutions. Are there benefits to having it in the powder form versus this pre-mixed solution?
By mixing it at the time of use, you are getting the benefits of supersaturation without evaporation of the calcium phosphate.
So I have to ask, doctor, though, are there any risks or side effects associated with it?
While the ingredients are recognized as safe, there is sodium, so that if someone is on a low salt diet, they should consult with their physician. It is a product to help to mitigate the painful symptoms of dry mouth.
Saliva, who knew? Doctor, thank you so much for giving us all this great information and providing us with real solutions.
Well, thank you so much for having me.
For more information on xerostomia, chronic dry mouth, and NeutraSal, go to NeutraSal.com. Or for more information, just log on to accesshealth.tv. Thank you.